if a patient comes in, let's say they have great healthy gums, and we do our little saliva test and we take some samples and we look under a microscope and we see it's loaded with these spirochetes. Well, that indicates there's an infection going on that down the road is going to affect their blood sugar control. Or down the road, they might even start getting what we call bone loss, gum disease. And what's interesting is this patient had no idea that they have this infection. They could have got this infection from kissing somebody, right? But what's interesting is they've been going to the dentist every 6 months, seeing the hygienist, and the hygienist gives them a pat on the shoulder and say, hey, listen, Betty, you're doing a great job. See you in 6 months. But they don't know what's going to happen 6 months or a year later, right? So now Betty develops a little pocket. The bad bacteria that causes this systemic disease, but also causes the bone loss in the gum, is at the base of the pocket, the bottom of the pocket. You can't take a string and hold it with 2 hands and get to the bottom of the pocket. So flossing is great if you have food stuck, but if you're looking to treat your gum disease, flossing is a waste of time. Plus, when you're flossing, what are you flossing? You have healthy bacteria on the top. The unhealthy bacteria is in the bottom. So you're flossing away all your good bacteria anyhow. So we teach our patients to, find other tools that are more effective. So we're big fans of oral irrigation. But then we start talking to them about their nutrition, and we start talking to them about their pH. We give them pH paper so they can measure the urine pH to see if they're in an acidic state or a more alkaline state. Because if I'm going to take a patient and say, hey, you have a problem starting, and it's not just about cleaning your teeth and sterilizing the area, it's about working on the entire body, because if the body is healthy, the mouth will heal on its own. On the other side, let's say they have a big perio problem, a lot of bone loss and loose teeth and stuff, and we do that little bacteria test, and we go to the microscope and we see no bugs. And you're like, oh my God, now you have no bugs, and we expect to see so much because they have gum disease, right? But that tells me that patient is a nutrition patient, because they got the mouth flora, the microbiome is good, but their nutrition, for whatever reason, isn't working. So now we send them to the nutritionist. What about if we do now a slide and we see parasites in the mouth? Well, every time I see a patient with parasites, I send them for a stool test, because if they have parasites in the mouth, almost always they have parasites in their stool, and now they need to clean up their intestines and the rest of the gut, because it's one tube, it's connected. So you have to work it from both ends. And that's what we do. If you want to take it a step further, we can actually do genetic tests using spit to see, are you genetically predisposed to gum disease? Because if someone is genetically predisposed to gum disease and they have heart disease or they have diabetes, then you know they better be coming in every 3 months, and they better be more diligent than their friend they go to work with who doesn't do anything and he's fine. So that's why genetics today is so important, because we know we can modulate our genetics. We were taught when we were younger that you had the genes from your parents. No, you can change your genes with the proper nutrition, and then you can go ahead and help the patient avoid extractions, avoid gum surgery, avoid cavities. And also with these spit tests, we can actually do more detailed diagnostics and look at 11 specific bacteria. So now we have something in paper that I can give to your doctor and say, hey, here's my issue with this patient. You need to support her. I'm not treating the body. I'm not making recommendations that by doing this treatment on your teeth, you'll help this condition. As a dentist, we have to stay within the confines of our practice, and we have to team up with another integrative medical doctor who makes recommendations, and then we can help support the patient based on what your doctor wants. We're dentists, and we use the same insurance codes that a regular dentist would use. So if you do have insurance, you come in, we do a procedure, and then we send out an insurance form with the same coding on it. So you can get reimbursed if you have insurance. However, some of the testing we do might not be covered by your insurance. The bottom line is your mouth is a barometer for your overall wellness. And if you start seeing breakdown in your mouth, then you almost know 10 years later, 20 years later, you're going to see breakdown in the rest of your body, which is going to cost you a lot more money to fix. It's going to cost, because now you have a medical problem. It's going to change your lifestyle. It's going to take you out of work. If we teach the body to be sustainable, then the patient will have less opportunity to have breakdown in the mouth. So they'll have less cavities, less gum disease. So it's not just, oh, don't use fluoride, don't use mercury. It's like, what's happening with your whole system? Where are you today? So we can help answer the question, which we get from patients so often, why do I have cavities? I think a big part of being a holistic dentist also is giving the patient the right to know what's going on in their mouth and letting them choose what direction they want to go in, and then supporting them. For many years, even before I became a holistic dentist, we were kind of gagged. We had a gag order. We couldn't discuss the fact that there was mercury in a filling. And everyone calls it a silver filling. There's hardly very little silver in these fillings. They're 50% mercury. So the reality is they should be called mercury fillings. So one of the bugaboos and controversy is fluoride. And the reality is fluoride has the ability to change different hormones and different systems in the whole body. It's also, in a way, a Band-Aid. Because if a patient spends their time drinking soda, let's say, and they think by having a fluoride rinse is going to help them, it's really going to maybe cloud the issue or cover up the potential problem. Because if they're putting soda in their mouth, they might be protecting their teeth with fluoride, but the soda is still having an overall effect on the rest of the body. So I always tell my patients that if you want to use fluoride, that's your choice. I won't recommend it, but I will recommend that you learn what your body needs and doesn't need in terms of proper nutrition. For instance, you should have a diet that's more alkalizing. If your body is alkaline, then you won't be prone to cavities, and then you don't need the fluoride. But if you're going to be sucking on mints all day long that have sugar in it, well, then maybe the fluoride might help you. There is so much research. Even if you look at having a sleeping problem or a breathing problem, you'd be amazed how poor breathing or sleep apnea can affect your hormones and your ability to function during the day. Hundreds of articles about just sleep apnea. That's such a powerful impact on even women who aren't really told they have sleep apnea, because there's a condition called upper airway resistance syndrome, UARS, where it's pretty much your woman who's tall, skinny, has some digestive problems, and she wakes up tired, and they do a test, and she doesn't have sleep apnea. She's not even snoring, but she's like this when she sleeps. So she has a little shudder, and that shudder affects her sympathetic nervous system and makes her heart rate faster, affects her hormones. So now her adrenals start getting fatigued. So now you have all these women walking around with adrenal fatigue. No one is looking to see how they're sleeping. So even, I call UARS like homeopathic sleep apnea because it's so subclinical. But it can be devastating to a woman because they're not getting their REM sleep, they're not getting their reparative sleep. Being healthy isn't a right. It's something you have to earn. And you have to do the work. So that's why you have to open up your computer, open up your books, look for the research, teach yourself what to do. And then that's how you choose your caregiver. Because if you go to a caregiver, whether it's a doctor or your dentist, you have the right to ask them questions. And if they don't know the answers to your questions, then you know you're in the wrong place.